Hi everyone, I am Dr. Anne Sylvestre, board certified veterinary surgeon and founder of Focus and Flourish. I wasn't going to put a GDV workshop on our website because, well, let's face it, they don't present that commonly to a small animal general practice. However, there are two compelling arguments that changed my mind. One, understanding how to manage a GDV patient can save a dog's life. That was a good enough reason for me. But two, these cases come to you first. And because time is of the essence when you're managing a GDV case, this is really important. The sooner you get to them, the more cardiovascularly stable they're likely to be. The more their tissues, the less trauma their tissues will have suffered because of vascular compromise. The easier the surgery will be, and the quicker and easier the post op recovery will be. So, all good reasons to get there fast. Having said that, you clearly don't have a say as to what stage of the disease the pet is when it walks into your hospital, and you just have to deal with what is presented to you. However, you do have a say in how you're going to manage them, how you're going to speak to the clients, and how decisions are going to be made. In this workshop, Dr. Brock, a board certified anesthesiologist, and myself, we have put a whole bunch of information and experience based tips and tricks to help you manage the GDV case and make the best decisions for your hospital, yourself, the client, and the pet.